My topic is longer-term outcomes of the ProACT trial. My name is Oscar Yupa Buñay, medical English teacher, Dr. John Moscoso. Definition. Procalcitonin is a protein associated with the body's response to a bacterial infection. High levels of procalcitonin in the blood indicate bacterial infection, with levels having a more serious infection such as sepsis. Procalcitonin levels decrease with a successful treatment of the infection.
Procalcitonina. Diagnóstico precoz de sepsis. Las infecciones más habituales que pueden originar una sepsis afectan a las vías respiratorias, como la neumonía, el intestino y el tracto urinario. Aunque cualquier infección en cualquier punto del organismo puede desencadenar el proceso inflamatorio que conduce a la sepsis. Las bacterias causantes de la sepsis se reproducen y diseminan rápidamente, de tal manera que con cada hora de retraso del comienzo del tratamiento antibiótico, la supervivencia disminuye aproximadamente un 8%. Las bacterias inducen la síntesis de procalcitonina en todos los tejidos del organismo, por lo que es un indicador muy precoz de la infección y sus valores se relacionan estrechamente con la gravedad de la misma. Los síntomas de la sepsis son variados y todos ellos comunes a otras patologías, lo que puede dificultar enormemente su diagnóstico. El control precoz del foco y la instauración del tratamiento adecuado son cruciales para la buena evolución del paciente. La detección de procalcitonina se realiza como parte de la rutina habitual cuando el paciente es atendido en el centro sanitario. No se requiere ninguna intervención especial, basta con un simple análisis de sangre. La tecnología de medición de procalcitonina, galardonada con un premio Nobel, permite una excepcional precisión y exactitud en la obtención de su valor en la sangre del paciente. Por ello, es importante que utilice siempre reactivos licenciados y validados clínicamente que asegurarán la máxima calidad que usted necesita. Conocer la concentración de procalcitonina mientras el enfermo permanece en el centro sanitario es fundamental para establecer muy pronto la terapia antibiótica, saber si es adecuada y mantenerla solo el tiempo necesario, evitando así sobretratamientos y favoreciendo la rápida recuperación del paciente. La utilización de procalcitonina como ayuda al diagnóstico precoz y tratamiento adecuado de la sepsis está avalada por más de 3.000 publicaciones científicas, favoreciendo la recuperación de los pacientes, pero también facilitando la optimización de los recursos sanitarios y, por tanto, contribuyendo a la reducción de costes innecesarios.
Application in medicine. Results from a national randomized clinical trial show that providing clinicians with the procalcitonin test results did not reduce antibiotic use in patients suspected of having lower respiratory tract infection. A team of the research from the New England Journal of the report this week medicine.
Procalcitonin is a biomarker that's used to help determine the duration of antibiotic therapy. However, its utility has come into question lately as concerns about antibiotic overuse and antibacterial resistance are in the ascendant. So, what do community physicians need to know? We asked Dr. Richard Wondering, who is a faculty member of the American College of Chest Physicians.
There are several randomized controlled trials of this biomarker that have been done that suggest that you can avoid antibiotic therapy if you have a low procalcitonin level. The procalcitonin is a biomarker that is elevated in response to bacterial infections. It is suppressed by viral infections. So you have this nice discriminating value when you're looking at infections that are possibly viral, possibly bacterial. It's also elevated when you have release of other cytokines, which is where it sometimes falls into some problems of being elevated in patients who may no longer have an infection. So the best data suggests that it may be beneficial in community-acquired pneumonia or in acute exacerbations of COPD. In that setting, several studies have shown that you can avoid antibiotics if you base therapy on procalcitonin. The problem with that is that some of the atypical bacterial infections can actually have low procalcitonin. In one of our studies, a quarter of patients with Legionella pneumonia had low procalcitonin levels at the level that would be suggested to not treat with antibiotics. Mycoplasma and chlamydia, about half of those have low procalcitonin levels. So it may have some benefit in saying if it's low, then you don't need the very aggressive beta-lactam treatment. The other place that it's of great benefit is in places where there's diagnostic uncertainty. Probably the best example of that is congestive heart failure, where there's actually a couple of studies that show if you treat patients who have low procalcitonin levels with antibiotics, that there's actually worse outcome, including worse mortality. Conversely, if you don't treat patients with elevated procalcitonins, that there's worse outcome as well. And this is one of the biggest issues where there's diagnostic confusion. We're not helped by our radiologists. They'll say, looks like pulmonary edema, can't rule out pneumonia. And so this is a situation where procalcitonin may be helpful. A lot of the European studies that use this try to avoid antibiotics from the very beginning. I think that's probably going to be very difficult in the US system, but what it will allow you to do is after that first dose or two in the emergency department, when the procalcitonin comes back, then you can either stop or modify antibiotic therapy based on the procalcitonin level. Procalcitonin also changes in response to treatment. So you can use procalcitonin to follow response to antibiotics. It suggests that you have appropriate antibiotics. Unfortunately, at some point in very severe infections, say sepsis or bacteremic pneumococcal pneumonia, the level plateaus and is no longer decreasing despite the bacteria clearly being gone. And we think that that is the fact that these cytokines raise the procalcitonin level as well. And so it's really a marker of ongoing inflammation rather than ongoing infection. So I think procalcitonin has a role in managing patients with infections, particularly respiratory tract infections, particularly milder infections where you might actually stop antibiotics or change the antibiotic regimen based on the procalcitonin level. And
Pros and cons. Pros. Previous clinical trials in Europe reported that the use of antibiotics was reduced by up to 50% when procalcitonin tests were used to aid in the clinical decision making. Cons. The observed proportion of patients receiving antibiotics in the procalcitonin group was less than the usual R group.
Roche Diagnostics, a leader in vitro diagnostic testing, is bringing the first fully integrated procalcitonin test to the U.S. market, the Alexis Brahms PCT test. In as little as 18 minutes, the test will measure the blood level of procalcitonin. Why is this important? Often, measuring organ failure using lactate levels is used to identify sepsis. However, lactate would not appear until the later stages of sepsis and will not indicate the underlying bacterial cause of infection. Bacteria is the major cause of the systemic infection in sepsis patients. As the bacterial infection continues to spread in the body, procalcitonin levels will rise, confirming the bacterial source of the infection. Measuring procalcitonin on the first day of admission will provide insight into the risk of progression through the stages of sepsis. In addition, to gain insight into the mortality risk of the patient, you can compare the levels of procalcitonin from the first day test to a test on the fourth day of their hospitalization. The comparison can indicate the effectiveness of sepsis management and help guide any necessary changes in patient management. What does this look like? For example, Mrs. Jones is admitted with suspected sepsis, and the first PCT test is administered. PCT levels will confirm a bacterial infection and give the physician early and reliable information to better understand the patient's sepsis state and effectively manage the infection with an appropriate treatment protocol. As the patient receives continued care in the hospital, it is recommended that a second test be administered on day 4 to assess their mortality risk and make appropriate clinical decisions. For example, if the day 0 level was 10 and the day 4 is 1, that is a 90% decline of procalcitonin levels over 4 days. This decline is indicative of significantly reduced mortality risk, providing the healthcare professional with the confidence to guide any changes to the patient's treatment. For example, with reduced mortality risk, Mrs. Jones could now be moved from a critical care setting to a general ward, possibly resulting in better patient management and significant cost savings. Alternatively, based on declining PCT levels, the healthcare professional could safely de-escalate the antibiotic treatment, resulting in appropriate usage of antibiotics and preventing potentially adverse outcomes. As a healthcare professional or laboratorian, wouldn't you want to communicate a more accurate prognosis to your patients? And wouldn't you want a faster way of knowing the risk of sepsis in your patient so you can confidently make timely management choices? Because even a correct decision is wrong when it is too late. With the Roche Alexis Brahms PCT test, it's time to win the fight against sepsis. Contact your Roche representative or call 1-800-346-8606. To learn more about Roche's PCT solutions, visit usdiagnostics.roche.com.
Issue a plague in Ecuador. A patient with a pulmonary parenchymal disease who attended the emergency department and the ward remodeled assigned to 2 groups. One group to receive antibiotics according to an algorithm based on procalcitonin. 2 groups to start antibiotics according to the institution protocols. Serum levels of procalcitonin and in the procalcitonin guided management group was fairly reacted when procalcitonin was smaller than 0.1 ng/ml, rejected when the levels was smaller than 0.25 ng/ml. Antibiotics were started with the procalcitonin level was higher 0.25 ng/ml, and the use of antibiotics with procalcitonin was highly recommended higher 0.5 ng/ml. Procalcitonin controls were performed at 6 to 20 hours and on days 3, 5, and 7. And the procedure was followed in the patients whose procalcitonin started was higher 10 ng/ml. antibodies were withdrawn when their levels decreased below 80% of the initial value.
Diagnostic value of procalcitonin in predicting bacteremia in intensive care unit. By Tuna Demirtal via Indian Journal of Critical Care Medicine, 2018-22 2. Tuna Demirtal, Pina Ursen, Salahadakan Nemle. Indian Journal of Critical Care Medicine 2018-22 2, 7884. Background and aims. Several biomarkers are used in the diagnosis of bacteremia. Procalcitonin, PCT, is more specific than other biomarkers in differentiating bacterial and non-bacterial inflammation. It was aimed to evaluate the diagnostic and prognostic value of PCT in bacteremic patients in intensive care unit, ICU. Materials and methods. A total of 156 patients diagnosed with non-infectious systemic inflammatory response syndrome, sepsis, and severe sepsis, septic shock in ICU between December 2014 and July 2015 were evaluated in this prospective cohort study. Results. The study group consisted of 64, 41%, bacteremic patients and the control group consisted of 92, 59%, non-bacteremic patients. The overall mortality rate was 60.3%. Although PCT levels in the bacteremic group, 11.9 plus minus 21.5 nanograms/dl, were higher than non-bacteremic group, 5.9 plus minus 11.5 nanograms/dl, this difference was not significant, p equals 0.168. The mean levels of PCT in bacteremic patients with gram-negative bacteria were 16.3 plus minus 27.6 nanograms/dl, whereas gram-positive bacteria were 7.3 plus minus 10.7 nanograms/dl, p equals 0.145.
Conclusion. The procalcitonin antibodies ProACT Trial ProACT showed that procalcitonin guidelines did not improve 30-day outcomes among patients with suspected lower respiratory tract infection. The investigators have now assessed mortality at 90 and 365 days. Again, found no evidence of the benefit.
Vitis Brahms procalcitonin-guided antibiotic therapy for patients with suspected or confirmed lower respiratory tract infection. In conjunction with clinical assessments, the use of PCT can enable more appropriate clinical decisions. Step 1. Evaluate. The purpose of this step is to determine if antibiotics are necessary. If serum or plasma concentration is less than 0.1 nanograms per milliliter, antibiotics are strongly discouraged. If serum or plasma concentration is between 0.1 and 0.25 nanograms per milliliter, antibiotics are discouraged. If serum or plasma concentration is between 0.26 and 0.5 nanograms per milliliter, antibiotics are encouraged. If serum or plasma concentration is greater than 0.5 nanograms per milliliter, antibiotics are strongly encouraged. Step 2. Monitor. The purpose of this step is to assess therapy effectiveness over time. Assessing PCT values over time provides valuable information regarding patient disposition, response to treatment, and can support decision-making on antibiotic discontinuation. Test follow-up samples once every 1 to 2 days, based upon physician discretion to support the decision to discontinue antibiotic therapy. Step 3. Discontinue. The purpose of this step is to assess when to discontinue antibiotics. Vitis Brahms PCT has been cleared by the FDA to aid in decision-making on antibiotic discontinuation for patients with suspected or confirmed lower respiratory tract infection. If the PCT level remains elevated, then treatment has been ineffective, and the physician should consider alternative treatment options. If the PCT level is less than 0.25 nanograms per milliliter, or there has been a change greater than 80% in PCT level, then discontinuation of antibiotics is encouraged.